Hey, Rodrigo.
Hey, Vivian.
How's it going?
Not so well. Last week had a little bit of a rough time, but I'm okay now.
I'm sorry to hear that, but I'm glad it's going a bit better for you today. Is there anything I can help you with?
Well, maybe you can shed some light into what kind of resources there are out there. I find that sometimes it's easy to forget to take care of ourselves, and it's really not the moment to be looking for resources when you're not feeling so well.
Yeah, it's so true. It's better to know who and what is available when and if you need it. And the people who are best suited to answer this are the people who work at the Student Wellness Hub.
The Wellness Hub? How could I find that?
They have a website that's really easy to navigate and lots of information that you can check out. Can I help you book an appointment?
Sure, thank you. Hi, Devin. I was hoping you could help me clarify some of the services that you offer to students.
So as the local wellness advisor for graduate students, my role really is to support grad students in prioritizing their health and well-being. So I offer a range of services from one-on-one support sessions to prevention and outreach. So I'll do workshops, help connect you to resources both on and off campus, and really help you develop a wellness plan. We really understand wellness as holistic and really taking your cues, right? So what are your wellness goals? Look at that, and then I can orient you accordingly to the services that might be a good fit for you. As a member of Student Services and the Wellness Hub, I'm connected to a large team of resources. At the Hub, which is one centralized location on McTavish, you'll find doctors, nurses, psychiatrists, dietitians, and you'll also find counselors. We're all here to sort of help you with your mental health and your well-being. With that said, your local wellness advisors and your access advisors can be your first entry into care.
Right, so what is the difference between, like, for example, a local wellness advisor and a counselor, for example?
It's a great question that we get all the time. So the local wellness advisors are mental health professionals. There's about maybe 18 of us or so, and we're all registered mental health clinicians. So myself, I'm a registered clinical social worker. We're embedded in faculties across campus. So you'll find us both downtown and at Mac campus. We offer a more nuanced or specialized service within a faculty. So the challenges and specificities of being an engineering student or at Des Hotels or in the Faculty of Arts, Law. Then we have local wellness advisors that are a bit more experience-based or sort of a broader community-based. So we have local wellness advisors for international students, racialized students, students that identify within the 2S LGBTQ+ community, students in residence, of which we have over 200 graduate students, and then students out at Mac campus. So in that way, we're really working with people where they're at. Counselors, who are also registered mental health clinicians, offer more one-on-one and therapy-based groups. The local wellness advisors, you'll find they're offering peer support groups, workshops, education, as well as one-on-one services. So that's a bit of the distinction, but we do work collaboratively. So if you were to see your local wellness advisor and decide together that counseling is your best option or something that fits your needs, we can refer you to either a counselor on campus or in the community.
So, like, out of all of these services, what would be the entry point or the main go-to place to go there from there?
It's a great question. So we have access advisors. They're really a good entry point. If you know that you have a question or something's not sitting right and you want to talk to someone and you're not sure how to navigate the resources, your access advisors are there to help you figure that out. You can also speak to your local wellness advisor within your faculty, or as myself, as the graduate local wellness advisor, I'm there to support grads across all faculties, right? So, you know, when we do a range of things together, right? So communication and setting goals with your PI or your supervisors, time management, anxieties, adjustment to GradLife, right? Connecting you to your peers. Peers are really important. We know that grad students sometimes experience at different times loneliness, or they're looking for, right? Their peers, right? They're looking for other grads. You can come to the Healthy Living Annex, which is part of the hub, and that you'll find therapy dogs, the art hive, you'll find your social space where you can find other students who are also part of your McGill community and your graduate community. So on that note, we know that the graduate student life and student concerns extend beyond Monday to Friday, right? So if you have a concern or a need outside of the sort of standard business hours, we're still here for you. There's a service called Keep Me Safe, which is administered by PGSS. And Keep Me Safe will connect you to a therapist or therapeutic supports 24 hours a day, 7 days a week, 365 days a year, in over 60 languages. Okay?
60 languages,
Yes.
Wow, that's amazing.
It's an incredible service. And what they're there to support you when the hub can't, or when you don't have access to other resources. So that's really evenings or weekends, or if you're traveling. Often, students will go back home or they're away for an internship or a sabbatical, and Keep Me Safe is there for you. And so that is administered through PGSS, which is your Postgraduate Student Society. And you'll just download the app and it talks you through it. I remember being a grad student, and it's hard to know what all the resources are. So the takeaway is just that you're not alone, right? And that you can contact your access advisors, you can check the Student Wellness Hub page, and you'll get more information.
It's great getting the info directly from the experts. I mean, not that you're not an expert too, but you know what I mean.
I try. On that note, actually, the Peer Support Center is a place you can drop by whenever you want someone to talk to, either when I'm not around or when you need more serious counseling information. And the peer support staff are trained for this. It's free, confidential, and you can just drop in.
Actually, I forgot to ask about the insurance plans.
Yeah, I can get you started off with the basics. So the most important thing to know is that both Canadian and international students do have access to a health and dental plan. But the main difference is who covers them. So while international students are covered by the McGill International Student Insurance Plan, managed by International Student Services, full-time Canadian students are covered by the PGSS Health Plan. So that's the basics, but insurance plans can get complicated and may even change from one semester to another. So the best thing to do is really to keep up to date with the plan that you're on.
Sounds good. I'll make sure to check out my plan. I wasn't even aware that I was already covered by an insurance. Not only do I feel more informed now, but I also feel more secure in knowing that there's a safety net there to support me if I ever need it.